So I'm doing Mrs. Smith, 78-year-old female, and doing the intradermal for 1 gram plus 1 dose. So I collect the right medication for the 1 gram, which is 1 dose, and I did the calculation. So I do the conversion, which is I need to drop 2 mils from the vial, and I have the 3 mil syringe and the blood needles and the 21 gauge of the needles for the adults. So first I'm gonna check all and then do hand hygiene, collect all the equipment and the medication, and check the MAR. Is it the right medication, the expired date, is it the right dose? And after that, and also I forgot to check the patient's allergy, the medication, the assessment, and the volume. Okay, now I'm gonna drop. Okay, first gonna open the cap using the alcohol swab to clean it, to clean the top, the rubber part, and take the 3 ml syringe and the blood needle, maintain the sterile, attach it, and then since I need to drop 2 mils of the solution, so I need to got 2 mils of air, okay, and then insert the air into the vial without touching the fluid, and then I need to drop 2 mils of the solution. And get rid of the air bubbles, and make sure it's 2 ml. Okay, then we cap it with 1 hand and change it with the 21 gauge of the needles for the adults. Maintain sterile, attach it, and check the medication and the amount against the MAR. So it's the correct medication, the correct dose, the 2 ml. So now I'm going to the patient's room and do hand hygiene, introduce myself. Hi, my name is Sharon. I'm the student nurse. I'm here for you to for the intramuscular injection. So and can I check your name? Are you Mrs. Smith? And can I get your date of birth? And check the patient's band. Okay, and check the allergy as well. And by checking up the allergy band and providing the privacy and position the client in the comfort position. And then I will need to check for the MAR, the 10 right, which is the right medication, right time, right dose, right route, right assessment, right documentation, right refills, right client education, and right assessment. Okay, so now I'm doing hand hygiene again, and then make sure it's the right medication again and the amount. And I'm gonna put on my gloves. choose the site for doing the injection. So for the intramuscular, I would choose so it's 2 ml. So I would choose the lateral size, the vascular lateral size. So which is in between with the bone here and the kneecap, and in between and on the lateral size, which is here. So I will landmark it and then use the alcohol swab to clean it. But I'm actually doing on here. So I will landmark it right here on the lateral side. Okay, and then I will clean the surface with alcohol swab. And then make sure it's the right medication, and dose is 2 ml. And then, so for the intramuscular, I will do the C-track to pull back the skin, and then do in 90 degree, and slowly drag it, and pull back while with the pressures on the injection sites for a few seconds. Okay, and then we cap it with one hand, and I will dispose the needles, the syringe into the sharp container. Okay, and then I will clean the stuff, remove the gloves, and throw into the garbage bag, and do hand hygiene again. And oh, I forgot to assess the skin of the patient, of the clients. Is any edema masses on the skin? And then, okay, so after I've done this, so I will reposition the patient. Reposition the patient into the comfort position and make sure it's safety and as any discomfort. After that, I will document the site of the condition of the site, and any tolerance for the client, any discomfort, and I will clean up everything.